Thank you for joining us. You are a part of an elite group who recognizes that Black women's health should be at the forefront of the national conversation. We are mothers, daughters, activists, entrepreneurs, entertainers, corporate warriors, and more, who help boost the economy and often drive the national conversation. For 38 years, the Black Women's Health Imperative has strived to amplify our voices, help enact policy that protects us, research our issues, create programs that enhance our lives, and produce events like this one to ensure we keep the conversation going about the issues that matter to us most. So, let's get started with our program.
Hello and welcome. I'm Darlene Richardson, and I am so excited to be with you today on behalf of Black Women's Health Imperative. We are so honored to partner with the African American Wellness Project and Chest Foundation for today's conversation, Educating During the Pandemic. Can Schools Pass the Test? But first, I want to tell you about Black Women's Health Imperative. Since 1983, we have been the only national organization dedicated solely to improving the health and wellness of our nation's 21 million Black women and girls, physically, emotionally, and financially. We believe that all Black women and girls should enjoy optimal health and well-being in a socially just society. Our mission is to lead the effort to solve the most pressing health issues that affect Black women and girls in the U.S. Through investments in evidence-based strategies, we deliver bold new programs and advocate for health-promoting policies. Earlier this year, Black Women's Health Imperative received a grant from the Rockefeller Foundation to address vaccine hesitancy in 5 major cities, including Oakland. So it is with that support that we're able to have this conversation with you today. Now, I would like to turn this over to the founder of the African American Wellness Project, Dr. Michael Lenore.
Well, thank you so much. Thank you so much for the opportunity to partner with the Black Women's Health Imperative. The African American Wellness Project, founded in Oakland over 20 years ago, was organized to respond to inequities in healthcare and delivery. African Americans suffer disproportionately from every conceivable disease from the cradle to the grave. Our feeling has always been that to reduce these health disparities, we really need to start thinking differently. Most of the time, you want to think from the top down, and Healthy People 2000, Healthy People 2010, 2015. But we believe that to change healthcare disparities, what happens to you when you enter the healthcare system, you have to be prepared. And we try to prepare you in a number of different ways. We provide contemporary news on African American health. We have on our health site, we have something called HealthWise, which many of you may be familiar with, that talks about over 30,000 conditions in a different way. You can check your symptoms, check the information about your diseases. We have Facebook Live programs. We have a variety of different ways, but always trying to improve the health of African Americans, primarily by having them develop systems of their own. So we're so pleased and proud for this partnership and to talk with them here in Oakland and across the country on this very important subject.
Thanks, Dr. Lenore. I'm Martin Wyatt and the moderator for this. And I tell you, education during the pandemic, can schools pass the test? I mean, the title of this forum, and it has to hit home to all of us. I mean, we're all parents or grandparents or got nieces and nephews in school systems all across the country. And the question that everyone wants to know is what's best for our children? And some school systems are requiring vaccinations now. And with the Delta variant spreading, should we even open the classrooms? I mean, what about distance learning? I mean, how does that impact students? And coming soon, vaccinations for 5 to 11-year-olds. I mean, what to do, who to believe. That's why the Black Women's Health Imperative and the African American Wellness Project coming together to bring this panel is so important. So let's hear the truth from the experts. And as the military says, those with boots on the ground, right? Forget the misinformation. Let's hear the truth. So let's meet our panel. You want boots on the ground? Our first panelist has been an educator in Oakland and in West Contra Costa for over 30 years, an elementary and a middle school teacher, a principal. Currently, she's supervising the West Contra Costa special education program, 7th grade through adult education, and supervises a team of nurses and health aides who ensure the health of the 28,000 students of the school district. She got her BA at UC Davis and her master's at Mills College, and she is living in West Contra Costa with her own child. Sonia Neely Johnson is our first panelist. The next panelist is an expert in addressing disparities among African American and students of color in schools and other social systems. For 20 years, he led the Oakland Freedom School program, effectively serving Black families and the community. And as a social worker with clinical experience, he spent over a decade of training clinicians how to provide mental and behavioral health support to individuals and groups. Graduate of UC Berkeley, a master's from Cal State, and his doctorate in educational leadership from San Francisco State. Dr. Mateo Payne lives in Oakland with 2 teenage sons. And next, she represents the future and what this whole program is about, our future. She knows what it feels to be back in the classroom, to have endured online learning. She's a 7th grade student in Oakland. Please welcome Marlo Irwin. And finally, Dr. Michael Lenore. We met briefly at the beginning, but he's an allergist and pediatrician, nationally known since 1977. He was also past president of the National Medical Association and a CBS radio medical editor for 15 years. And since 2000, every year, Dr. Lenore has been named as one of the top physicians in the San Francisco and Oakland Bay Area. So Dr. Lenore, let's get this whole thing started with you, because this is what it's all about. This Delta variant continues to just spread. I mean, do you think it was a good idea for classrooms to open at all? Let's get it started there.
Yeah, I think it was a good idea. I think this is always a balance. The way in which single person learning at home works just as a transitional piece to real education. I think if you look at it from an educational standpoint, obviously this was not the best way to educate our children. I think it's a good idea if, in fact, certain things are in place. Certain patients have to be vaccinated. The students have to be vaccinated as much as they can, based on the fact that we only have vaccinations down to age 12. Teachers should be vaccinated. Parents should be vaccinated. Certainly social distancing should be maintained. And I think if we can do that, then I think that certainly it's a good idea to get started. I think what threw a wrench in the whole thing is the aggressiveness of the Delta virus. It is a very infectious virus that passes from person to person and impacts children more than it does, as much as it does adults. And so consequently, I think that if we're to succeed in this effort to reopen the schools, those things everybody has to be vaccinated. And all those same measures that we used to keep the coronavirus at bay before schools open need to be opening. And we're starting to see that some of the rates of infection in children and schools is lessening. And so consequently, maybe we're getting to a point where that we've learned enough that this can be a successful venture.
Dr. Mateo Payne, Dr. Payne, do you feel the Oakland schools are taking the necessary precautions, as Dr. Lenore has pointed out, to keep the children safe? I think you're muted, Dr. Payne. Yeah.
Every day. So yes, I do think that Oakland Unified is taking the necessary precautions. As a parent with my kid in the school, they send out the emails. It's been no one's ever done this, right? So school districts, this is new for them, and the whole process of enrollment and getting your schedule and everything. The flip side is there's been a lot of technology adopted by these districts, which actually help bringing kids back and giving the necessary information as well as precautions. The school has masks at the front door, so we're not worried about kids getting sent home because they don't have a mask, or right. So I'm seeing a lot of focus and attention on that because obviously that's what parents are most concerned about.
Well, let's go to Marlo. I mean, you're a student in school. You're muted too, by the way, Marlo. Do you feel safe? I mean, going back to school, you're back in it.
Well, for the most part, yes. There are definitely times when I come in close contact with like other students. Like for example, at lunch, many students may be like sitting together, eating with their mask off, or many people will be in the hallways in between periods trying to get from class to class. But since most other students and all faculty members are vaccinated, and I know my school has an action plan if anybody were to get COVID, I do feel much safer at school.
You know, there's a lot of things being mandated, and I'm curious to go to Sonia Neely Johnson. Have you lost teachers in the district because, you know, they got mandatory vaccinations and so forth? Is this an issue, or is it a made up issue?
So I do think we lost teachers. Actually, we lost teachers when we said we were coming back 100% in person. The people that are here now in our schools are committed. And I just think that everyone has to kind of make this personal choice. But our teachers union actually mandated that teachers be vaccinated for our spring reopening. And so consequently, or actually it's a good thing that I would say 90% of our employees are vaccinated. And, you know, as long as we are continuing to follow the CDC guidelines, as a district, we do provide the appropriate PPE, and we continue to educate not just our students, but our also staff just about, you know, those precautions. And so we had a lot of time to practice in the spring. We had full programs in the summer. So I feel like it's been very successful. I think what Dr. Payne said, this is something we've never done before. And so we just constantly teach that, you know what, we are following CDC guidelines. Things may change in a minute's notice because we've had to close down some classrooms. But we reopen in 10 days. So we're following the guidelines, but our goal is to keep students engaged because like Dr. Lenora said, the distance learning was patchwork. Our students need in person and to be really engaged, and schools are really safe havens for many of our students.
Wow, that's a lot to think about, and I failed to mention it at the very beginning that if you in our audience have questions, please you can come in on the private chats, and we're going to bring those questions up to the panel at the end of this program. So please put whatever questions you have up, and we'll be happy to make certain that the panel gets them. Dr. Lenore, you know, everybody's bringing this up and what they're doing and their variants coming out. Do you see an end to this pandemic at all?
Well, no, not in the immediate future. I don't. I think even with vaccinations, if you recall, and probably many of you were not even born when polio was first described and running rampant in our country, that we developed a vaccine, and the vaccine had wholehearted support, and so consequently became part of our culture. But it took 50 years before the polio vaccine eradicated polio. Wow. This vaccine, I think, will be here with us very much like the flu vaccine, like the flu virus. It'll be here every year. It'll be around. And I believe that if you're not vaccinated, you are going to get an infection because it's the very infectious nature of the virus means that it's going to jump on anybody who's unvaccinated every time it can. So that those of you who are unvaccinated are going to continue to try to live your normal lifestyle, and that's fine. But you are going to get the virus. You may not end up in the emergency room or the hospital, but you will get infected. What's synonymous with that though is something called the long haul. 1/3 of the people who get the viral infection will get some residual. It'll be either pulmonary, chest, or it'll be neurologic, or it'll be cardiac. And so consequently, you won't get away clean in many instances just by getting the infection, and you still will carry the virus if you're unvaccinated. One final figure: almost 90%, 99% of people who die from the coronavirus now are the unvaccinated. And so consequently, sometime in your life, be prepared to deal with an infection, and it will not go away soon.
Wow. To unpack this a little bit, this pandemic has affected everybody. I'm curious, and I'd like to go to Dr. Macheo, Dr. Payne. How has the pandemic impacted children's social development and educational development? You're muted, Dr. Payne.
It's been a significant impact, particularly because for teens and for young children, think about it. Not only are schools closed, but other social spaces for families to gather are closed. So, and it's a total system impact. So these young people have been significantly impacted, and I think it's not a good thing with the isolation. Now, I tried to look at the good side. Well, my kids, they got their dad in their face all year, but you got to ask them if that was worth it or not. But for families who don't have a lot of luxuries and a lot of freedoms with schools being shut down, I think it's critically important for those families that children get back in school, interacting with other kids, and doing it in a way that they feel safe.
Thank you, Dr. Payne. Marlo, you're the student. I want to know, what's the biggest thing you feel students have lost in this last year and a half, and what do you miss most?
Well, personally, I feel like I have lost social interaction or like socializing skills because for such a long time during distance learning, I was able to easily just message like my friends and classmates. But when I first went back to school in person, it was harder for me to meet new people and make friends. And especially because of COVID-19, like I was hesitant to talk to people or get close to people. Because some families were scared to send their students back to school because they didn't want them to get COVID either. But also, I feel like I've lost the skill of like remembering what I was taught in my classes because when I was online, when I forgot something, I was able to easily just look back at my notes I had online or look something up. But now that I'm back at school and I don't have that like opportunity, it's like much harder for me to remember things I've learned in class.
So you can't just go to the internet and get the answers like you were doing online. Very good, Marlo. I love it. Here's something that's curious to me, and I don't want to go to Dr. Lenore. Students under 12 can't get vaccinated, and maybe they will in the winter, as we're saying. But what should parents, should they take extra precautions? Or what should you do for these students who are not vaccinated?
I think the best thing to do is for them to get vaccinated. I mean, there really isn't much to do. Fortunately, children have a stronger immune system for a number of reasons than do adults, and they can resist certain things. But I think if a child's not vaccinated, you have to take the same precautions with your children that you were taking with yourself before you got vaccinated. And so I think but the most important thing is not only for them to get vaccinated, but also for them to continue to keep those things going. What we've tried to do is to recruit grandparents and parents of parents who have school-age children to get vaccinated, because we're seeing in my own practice that younger people of school-age children don't want this vaccine. And so I think that if you don't want the vaccine and you won't get vaccinated, then you need to insist at home and everywhere you go that you institute those same measures you instituted when you were afraid back in the hot days of the pandemic.
Oh boy, Asanya, what are schools doing about unvaccinated students who are eligible to receive the vaccination? Or are they putting any pressure on them, or what's being done about that?
Well, I'll say that at many of our schools, we have what we call student ambassadors. And so really there's still been so much misinformation. And so we really are focusing on, looking at science and looking at what the research is saying. And so we have student ambassadors at all our schools that are, engaging with their peers about this. And I think that that's more powerful because students tend to listen to each other. In addition, we have opportunities for students to get vaccinated at any time during the school day. Our health clinics are on our high school campuses, but we also have mobile health clinics that are going throughout our district, providing, and each school has a day where there's either COVID testing or there's vaccinations. And so that has been pretty successful. And we did get a lot of students to get vaccinated in this way. And then we also are working closely with our county health departments to, show our parents other places where they can access. But I would say, agreeing with everyone that is on the panel, vaccinations for age eligible is going to be the way to keep students in class. We don't like closing down classrooms. We know it has an impact on students learning, because I think one of the questions was what was the direct impact? So you heard Marlo talk about the mental health, which is the social emotional pieces, but there's learning loss and also physical health. Many of our students are sedentary, and when you're at school, you're moving around, you have access to PE, you have access to a lot of other resources. And so we want students in class. And so the best way is to have everyone vaccinated.
Well, Dr. Payne, I want to go to you because Marlo kind of mentioned it about the health and mentally issues that all these children have to go through, not only them, but parents also. All this talk, I mean, how has it impacted the children's social development and educational development as you as a clinician has looked at this?
And I'm unmuted. So what it actually does is it limits their opportunities to learn about themselves through interacting with other kids, right? That's the social development dynamic. And the other piece is, while us adults are at work all day and they're at school all day, they get to engage in age-appropriate behavior. So if the kids are at home all day and they got their parents looking at them like, are you on your Zoom? Did you do your homework, right? And they don't have a break to go engage in age-appropriate behavior, which is super silly, just having fun. And so children being around adults all the time, not being around other kids, kind of short circuits their ability to be age appropriate in terms of what they're expected to be in terms of a level of maturity. And it's really flipped all of that on its head when the parents became teachers and then the students became college students.
Wow. I'd like to go to Marlo again. Are most of your friends vaccinated, or any of them vaccinated? And what advice, if any, have you given to friends who are hesitant? And are you hesitant?
Well, yes, all of my friends are fully vaccinated now. But before I got vaccinated, I was hesitant about getting the vaccination because I was skeptical about what was in it and how it would affect me. And so I would tell people who are hesitant about getting the vaccine that, once you get it, you feel much, much safer going out, going back to school and doing all the things that you used to do before COVID-19. And I'm not afraid of getting COVID, or even if I get it, of having bad side effects because I'm fully vaccinated. And sometimes when I'm at school, I forget COVID is even a thing or is still present because I'm basically just doing everything I used to do, just wearing a mask.
Thank you, Marlo. Dr. Payne, I want to go to you because what I was thinking about and listening to Marlo and everyone else is, this is a topic of conversation all over the country. We're talking about deaths, counting them, discussing a death all the time related to COVID. This has to have impacted discussions with your children. How do we do that? How do we deal with that to tamper that down and keep some kind of balance? We don't want it dark, fear all the time.
Mm-hmm. So open discussion, right? When you have open discussion in your household around people that fall on both sides of the debate, you get to have ongoing conversations where we're just bringing in new information, right? So it's not about staking, hey, vaccines forever for life, or no, we'll never get it. But it's about what's the best option right now with what's going on with what we're dealing with. And so my kids can come home and say, hey, I talked, this person at work was saying da-da-da, this person at school was saying da-da-da. So there's an additional layer of discussion that can happen with all of the other information they're getting from other sources, which is critical because no one's vetting the sources of the information. We're all just sharing it.
Yeah. Well, we got the expert here, Dr. Lenore.
We do.
This is the question that I think is going to come up because we got the winter time coming, flu season. There's going to be a winter break. Do you think maybe we should take an extended winter break because of the spread of the virus during the winter months, and we know it's probably going to be more and higher?
I don't think that would really change the dynamic very much. A longer winter break maybe gives people more opportunities to mix in environments that are not good for them. So I don't think that's going to be the issue. The issue is that in the winter, these viruses seem to thrive. And so that we've shown with the flu vaccine, that flu vaccines, the flu virus jumps on us more often in the winter. And so the same thing is true for the coronavirus. Then from now on, you've got all these holidays, Thanksgiving, Christmas, New Year's, where people are going to mingle. So I think you're going to see a natural spike in infectivity of the virus in the winter, simply on the basis of the character of the virus. And I don't think an extended break would make a lot of difference. I think it would disrupt whatever pattern that has been established based upon some of the experiences that school districts will have over the next month.
Marlo, what I want to know, are you getting tested regularly? Are students tested regularly?
Yeah. Well, for the students that are not yet fully vaccinated, I believe are getting tested at least once a week. However, I know that at some other Oakland schools my friends go to, I've heard that it's much different. Students that are not vaccinated have not been getting tested unless they know that they've been in contact with someone who has tested positive for COVID-19. But yeah.
Sonia, how often do you think schools should be testing for COVID as an administrator and all?
Yeah, so we in our district, and I do agree with this, that we should be testing once a week. In addition, we are monitoring positive cases and exposures. So the people that I supervise are doing contact tracing. And so this is helpful because what we know is that, we're looking at what CDC is saying, right? The direct contact, at least for 15 minutes. And so we really do want to get as much information so that we then know how to mitigate. But yes, I think weekly testing makes sense for all employees, vaccinated or unvaccinated. And we are making sure that that is available throughout all of our schools. We've just switched recently to another company just because we wanted to get our results faster. And so we have invested the money and the time, and we also have hired more staff. One of the things that I want to say, and since I'm on here, is to say that the state has given us a lot of money to put in a lot of these resources to hire additional staff, to expand our after-school programs, et cetera. But it's one-time money. And so we have to continue to advocate, for sure in our state, but I would say throughout our country, to fully fund public schools so that we can meet these challenges.
Mark, can I say something, Mark, on this subject? I don't know what's going on in Dr. Johnson School District, but as a pediatrician, I can tell you, half of the patients that we see have been sent home from school because they had colds or sniffles or didn't look right, and most of them are not COVID positive. But they all have to come out of school. They all have to go get a test. I'm sure it's very disruptive to the educational system because patients with allergy, patients with regular viruses are being sent home. And so at least 50% of the patients that we see now have been sent home from school with symptoms that otherwise would not alarm us. I would not even send them home from school because I guess they have to.
Yeah. Do you see any way that this can be changed, Sonia, as an administrator?
So I would say that we are actually telling people not to do that. So we now have rapid testing. So, if a student gets sent to the office with the sniffles, or we know they have allergies, we can actually do the rapid test and to, get that result within a few minutes, and then those students can be sent back to class. I want to say that it is something that we're a large district, 28,000 students, right? And so we really do depend on our administrators to go over these protocols with our educators. And, there's also that just level of fear, right? I think we're getting to a point because when people see positives, because a letter is sent home to parents to say, oh, there was a positive at your school today. We also have dashboards on our websites. And so, people become very anxious. But once they see that the protocols that we're using are working and, we're not having to close down full classrooms, I think we will get better at this. So I'm hoping, Dr. Lenore, you will see less of that as we build up our protocols.
Speaking of protocols, Dr. Payne, do you have any concerns with children wearing a mask, basically all day?
Yeah, I have concerns about the students that my kid will be around that aren't wearing masks, right? So, but then there's also a challenge around hearing each other, reading each other's face. So there's still there's a trade-off, right? There's a cost-benefit analysis to wearing a mask all day, right? Not being able to breathe, there's really nothing more important than that. So these other things are not the greatest, but in an effort, being locked up for 18 months really is what we're seeing. And the young people are being cautious and somewhat safe. I think that the most important thing is that all the adults reinforce the backup and support of wearing a mask, since we don't know who's vaccinated or unvaccinated. That's private information. Even if we're in a public system, you also have people that aren't vaccinated and are saying they're vaccinated, right? So I'm happy with the masks, and I think it's an important step that should stay in place until, like Sonia mentioned, and like Dr. Lenore mentioned, after the winter. There's still a lot we have to learn. This is just the first month of the first time this has ever been done.
Marlo, do you feel that your other students around you and your friends, are they taking these requirements seriously? Do you think they're taking them seriously? Does it seem that way to you?
Yeah, everybody at my school does wear their mask. There's not really any times anybody's walking around with their mask down. So I think everybody is aware of that, but that's the only requirement we have at my school because the desks are still close together and we're still able to do group work and hands-on work. But yeah, that's just the only requirement, and I think that everybody's following it.
Well, Dr. Lenore, what do you think the school should be doing in the classroom and to help fight this or to prevent? There's things that, the desk, I don't know. What do you think that should be done?
I think there were great challenges about what to be done with kids in class before the pandemic. I can't imagine the challenges schools face now, trying to keep youngsters from violating their protocols. I just think that they can do the best they can do. They seem to be very, very creative and very, very responsive to immediate needs, like getting the quick test, although the tests are not always accurate. I think most of the children that we send for testing that are sent home are not COVID positive. So I think that they're doing a pretty good job. I think as was said by a previous responder, that Dr. Payne, that they're doing the best they can. You know what I mean? We're all learning as we go along. And I think schools, unlike a lot of part of other institutions, have seemed to be much more flexible and much more responsive and with quick reactivity of making change. I think they may become a model for how we deal with this virus in the public space.
Dr. Lenore, do you see any other variants coming our way that we don't even know about? Is that something that we should start kind of keeping our antennas up for?
Well, you have to understand viruses. When viruses replicate, it's just like any other biologic process. Some of them are not perfect. They may not be perfect as the virus, so they wouldn't be invited to the dance by the other viruses, coronaviruses, but they have unique abilities to enter cells because they are variants. So we're seeing variants all the time, but most of them are not so different that they can't be handled by the present vaccines. I worry that we'll get a variant that will just laugh at the vaccines. And if we do that, then I think we will have some problems. But I think the scientific community anticipates that. And they're prepared, I think, very quickly to change the nature of the vaccine in response to that type of variant. In addition, you have to remember that we're worried about people being sick and dying from the disease. And the monoclonal antibodies, you've heard about those. Those are antibodies that are uniquely developed to attack this virus when someone is infected. And I think that's going to be another big area that will keep you from dying from the virus. But I do think that there are variants all the time. But most of them, with the exception of this Delta virus, have not had the characteristics that would make them resistant to the vaccine. And even the Delta virus, when you're vaccinated and you break through with your vaccination, then you are still protected from the more serious forms of the disease and from dying.
You know, Sonia, you brought in something up about, or I got to remind our audience that please, you can send in your questions because we're going to start going to them in about 5 or 10 minutes through the private chat, and we'll be happy to put them before the panel. But we did have one. Our parents, I'm saying, can we rely on these rapid tests, as you pointed out, Sonia, that they have at the schools? Can you rely on those?
I think that's a question for Dr. Lenore, but I'll tell you what we have. We have rapid tests. So like the example I use, if a student gets sent to the office, then we can do the rapid test and then the student can go back if it's, of course, negative. But we also have been doing other tests where they get the results in, and that goes through a laboratory, and that's the 48 hours. And so some people have opted for that. And many times we do bring in families to make these decisions. And so sometimes families say, I want my child to come home, and then, they can take the other test and I'll wait 2 days. So really, we do involve families in that decision. The rapid test, though, many times kind of gives us information right away. And I know many of our athletes have been using this so that they can continue to participate in sports activities.
What would be interesting, though, is since you have the rapid test and you have access to the other tests, is to get 2 tests on several groups of students. And that will tell you the accuracy of the rapid test. If, get maybe 15, 20, you probably wouldn't need a large sample, but maybe 35, 25 or 30 students where you get both the rapid test and the other test and compare the results to see what the accuracy is for that particular test.
Is there, everybody, we know that fully vaccinated people, can catch and spread the virus. So shouldn't everybody be tested? Not just because you were bringing up that if you're vaccinated, and I think Marlo indicated that the unvaccinated have to do more. Shouldn't everybody be tested regularly? I'll throw that out to Doctor and to everybody else in the panel.
I believe so. I think logistically is the main issue or problem, but in terms of a cost-benefit analysis on safety, it should be a go.
I would agree. I also want to say too that we also have a lot of students in some of our schools with extensive support needs, and so many of those families have said, "I want my child tested more than once a week." But at least once a week is what schools have the capacity right now to handle.
Dr. Lenore?
I would say children with symptoms should be tested, whether they've been vaccinated or not. I just don't think it's going to be practical to test everybody as often as they would need to be tested. But if they have symptoms, even if they've been vaccinated, they should have a test. But I just don't think it's going. I mean, I think we're going to have to learn to live with some risk factors. And I think testing every student would be so disruptive to the whole educational process. But if they're vaccinated and they have symptoms, then I think that's a good criteria to test a vaccinated student.
Sonia, you brought up that the state has to, really fund the schools. Is there anything that like small businesses can do to help schools?
I would say any donations, right? Donations to our schools to just support some of the activities that we intend to spend money on, right? So, but yes, small businesses can also very much be a part of that. I know in our neighboring city in San Francisco, some small businesses now require, like restaurants specifically, that you are vaccinated, right? So maybe even adopting some of those policies so that we are encouraging more to be vaccinated. And then it's just a regular part of life, right? Just to say, hey, if you want to participate in coming into my store or going to my restaurant, you have to be vaccinated. And then I think that will for sure help our families make that decision.
Okay. If a vaccinated person, and I want to throw this to Dr. Lenore, I'm vaccinated. If I get COVID, am I going to experience that long haul symptoms?
No, the long haul symptoms are not as common when vaccinated people are carrying the virus. And so that's been demonstrated. The vaccination keeps you, if you break through, and I think you expected, when they did the research projects, they said that this vaccine was 95% effective. Well, that meant 5% it wasn't effective. And so that's a lot of people when you multiply it by millions of people. And so I think that under those circumstances, that you have to really start to think about, I think I lost track of the question. What was the question again?
About the long haul symptoms, or if you're vaccinated.
I think I talked myself past the question. But I think that the long haul is not as significant in patients who are vaccinated.
By the way, audience, fill in your questions, and then we'll share them with the panel shortly. But in one person wrote in that they're in Virginia. How can they learn to help in their school district? Sonia, you brought up things for your district. Dr. Payne, how can the people all across the country? How can they help out, and how can they find out how to help? That's the question. Sonia, do you have any idea, or Dr. Payne?
Help how? Help what? Help
the schools. Sonia had mentioned that, okay, some businesses are, by just the fact that they're asking you to prove your vaccination, that helps all the way around. Okay, we'll go on to that.
I would say one of the things I would say is that if people want to volunteer in schools, they need to be vaccinated. That is one of our requirements, or they have to show a negative COVID test within 24 hours. And so many of our volunteers are getting vaccinated because they want to be a part of their children's education. And so that's another piece that we put in. But yes, anything that businesses can do, volunteer. We always need volunteers to help, make even groups smaller. So that they're in middle and high school, the classroom numbers are a little larger. And so if we can break them down into smaller groups to get support, that's even better.
I'm curious, Marlo, how was online learning, the distance learning, how did that go for you, and how did it work in Oakland?
Well, at my school, I think they did a really good job with the distance learning, and they made it like organized and easy and exciting for students. Because, well, in the morning we just had to log on to one school website to access all of our like Zoom class links, all our schedules and homework assignments. So I think that made it really easy. But I heard that at other Oakland schools, it was much more difficult with the distance learning because some teachers wouldn't be able to like make it to their classes and they had to cancel all the time. And sometimes like they only had one Zoom meeting like a day, like at weird times, like when people were eating lunch or doing some other things. And I heard that like homework assignments weren't as easy to access and stuff like that. But yeah, but I think my school did a very good job with it.
Dr. Payne, and you may have answered this, but I want to make certain we hit it. What's the long-term sociological impact of, being on Zoom calls and the isolation of teens and children?
Oh, so I actually teach at CSUEB in the social work program. So I, initially been teaching 10 years in person, and teaching on Zoom was not fun in the beginning because you can't. There's a lot of limitations. Students also experience a great deal of anxiety. Now, this is a graduate program, so these are 24 and up, right? Adults. So I think Marlo addressed it when she said she immediately noticed the switch in her skills of memory and recall, and these are educational skills. So now going back into the classroom, I'm feeling like, oh, well, I've kind of got the hang of this Zoom thing. So I think the long-term effects are, without saying they're good or bad, they create an environment where children in particular are less socialized, less able to have self-regulation and self-control, because that is the work, right, of education aside from academics. And so I think long-term, folks are going to be more socially avoidant or less able to do the in-person reliance on the brain. I mean, we all have these phones too. So this isn't the only impact that's creating this dynamic in our society. So, but before COVID, I used to say that most of the jobs that Marlo and kids her age are going to have in 15, 20 years, those jobs don't exist today. And I think the technology piece is leaving my generation behind, and Marlo's generation is ready for it. So that's my answer, but I think it's different for the younger generation.
Okay. Once again, I want to remind the audience that they can put their questions up, because we're going to start posing them to the panel in a few minutes. But one more thing: is there counseling for students, Sonia? If they got questions about COVID, or they got some trauma, are these services being presented? Should they be, and how can that get done?
So I want to say, just in the state of California, we have what we call a restorative start, right? And so our state recommended that we start the first 6 weeks really addressing students' social emotional health. And so what that meant was, just checking in with students, doing wellness checks, and actually screening. I'm in special ed. And so we've had a lot of referrals for students that have experienced anxiety and depression. So there has been counseling that has been provided for students who need that. And then for some students, it became so bad that now it is a diagnosis. And so they get what we call ERMS counseling. They may be seeing a counselor once a week. But our health centers also have counselors where students can just drop in and just say, hey, I'm feeling overwhelmed. I just need a check-in. And so once again, like I said, California had this restorative start. They really wanted us to give time for students to readjust, to provide spaces where students could, feel safe, engage with not only the adults, but also with their peers, because that was the piece that was missing. But I would say any student that is feeling that, I always recommend to contact the teacher or the principal to set up what we call a student team meeting and see if, counseling is something we need to do on a regular basis, or maybe it just needs to be a check-in.
Marlo, do you see this actually happening? I mean, you're there, you're the student that some of your friends and colleagues or other students are depressed. Do they express this to you? Are they going to the counseling? Do you see that as a good source?
Yeah, I mean, I know a lot of people, like my friends and other people at my school, like get like overwhelmed and have like a lot of anxiety around school. But there's one like school counselor that anybody can go to, and we also have each student also has a life skills class once every week to like address things that they may be struggling with in a small group and to seek advice and everything. But I do know like some people who do struggle with maybe like anxiety and depression because of school or maybe other things like in their household. But I do think that my school has provided like the help needed for that.
Thank you, Marlo. Dr. Payne, I mean, I guess that COVID trauma issue and all those questions, that's right in your wheelhouse. I should have asked that to you, but I still would like to get your response on that. And
Certainly.
the counseling and the questions about COVID and all the trauma that's associated with what's happening.
Certainly. So again, before all of this happened, there was already the need for counseling, overwhelming need for counseling for students in schools. And now I'm actually a part of a project called the Vax, and we're specifically targeting young people in Oakland that are vaccine hesitant. And so the intervention is not based in schools, but is targeting those students that are school age to really have the conversation around the medical community and the Black community and what's up with this vaccine, so that it's a discussion, not a debate. And what it does is it allows for those fears right, because somebody's vaccine hesitancy, they don't want to be called stupid or dumb or, they're messing it up for everybody, but they're afraid and they have a hesitant, right, set of information that has them hesitant. So we want to open up the conversation and have those conversations above and beyond this COVID vaccine and this Delta variant. But how do we access medical services and mental health services in general as it relates to a host of issues that particularly African-American people experience in schools?
Dr. Lenore, I know in your practice, you run across and you see this vaccine people who don't want to deal with it. How do you deal with it? I mean, as a doctor, they have to come to you and they talk to you. Maybe they tell you, hey, I don't believe you, or what do they say?
Well, quite clearly, they're getting information from a different source, and we're giving information too. I've heard all kinds of hesitancy issues, especially now that they're pretty recalcitrant to conversation. I've heard the fact one of my patients was waiting for God to tell him when to get vaccinated. And especially the Black males, they really feel that they're so strong and robust that no virus would dare attack them. So that's another conversation. I know some of my patients know somebody who knows 3 people who died from the vaccine. Now that would be almost 100% of the people in California. So these are pretty entrenched patients. But I do think that my relationship with them allows me to say to them, just get vaccinated. I know you're concerned, but I've been vaccinated. I told them I got 3. I wanted 4 vaccines. I got 3. And I talked to them as I would talk to them about other issues that appear in their lives when I'm in their position. So I do think that I think we haven't discussed. I think that Dr. Payne is right about how it should be done. But I think we're pretty close to the mandate stage now, because I think the ones that are not getting vaccinated, especially in that group of people, are very difficult to persuade. And you wonder if it's a risk-benefit issue. That maybe mandates, it's time to start talking about mandates. And I certainly would appreciate what other people have to think about that.
Thank you, Doctor. We've got some questions, and we're going to start. I don't see them on my board yet, but I know we got a lot of questions from the audience, and we want to get through. Here we are. Here's from Tiaget. With breakout infections and false negative test results, how effective is it for businesses and venues to require proof of being vaccinated or showing test results when someone could potentially still be infected? Dr. Lenore and
Well, I think you're right. I think it's either all or none, and from my perspective now, either you're vaccinated or you're not, and the vaccine policies. Many businesses are looking at this as a way to decrease the length of the infection on their own businesses, and so I just think I think it's tough. I think we're going to have to have certified. I think we're going to mandates. I just believe that. We've gotten to the point where we talk to as many people as we can, and I'm thinking that mandates is the only way to at least assure somebody is vaccinated.
Sonia, do you think that's going to work? You're as an educator and one who's supervising a whole host of staff. Is that going to work? The mandatory?
Well, I think that in terms of your employment, because in terms of, you cannot work, and that then is your income, your livelihood. I think people have to make those choices, and more than likely people will say, okay, I'm going to get the vaccination. I mean, I've had family members that have been hesitant, and I've just tried to, give them statistics, and do it with grace, right? And it's interesting because they come back and they ask me questions. And I would say of those family members that were hesitant, they now are vaccinated, but it took them some time. But me being patient and really listening, but also giving them some hard, true facts.
Dr. Payne?
Again, I like to reference before the pandemic, you had businesses in all kinds of states fighting for the right to refuse people based on their sexual orientation or their race, right? And it was their right to do that for their business, right? And also before the pandemic, you have, city of Oakland to go to a meeting in the city hall. They tell you, don't wear perfume. Like, we have been in this controlled, mandated environment for a while. And if I have a business, if I have a company and I say, you got to be vaccinated to patronize my business, if you don't like it, you don't patronize the business, right? And I think what we're dealing with is folks who wanted to be vaccinated are vaccinated and are trying to carve out a safe path forward. And folks who don't want to be vaccinated have a issue with the ongoing coming exclusions. And so it really is that I understand the frustration around that, but we can't have it both ways. You can't have your 100% American freedom and then expect everybody to let you into their setting that isn't 100% public and free for you to come into.
Okay, last question. This is from Cassie Bedford. With all the misinformation out there, how can we be sure we're getting accurate information to keep our families and loved ones safe? I think I'd like everyone to reply on that one. Start with Dr. Lenore.
Well, I think that you have to get vetted sources. I think that one of the things that I'm proud about my colleagues across the country is that they're out there and available for you to talk to them very frankly. I think that vetted sources, either medical sources, we at the African American Wellness Project have a lot of information. I think you have to listen to the CDC and the FDA. And I think that when they have this confusion about whether you need a booster shot or not is a classic example. That was a discussion among the administration and its panel. The CDC and the FDA have not really issued their opinions quite yet, but they're very reputable groups. So I think go into the CDC site, the FDA site, and deal with people that you learn to trust, either online or in person, or your own personal physician or a personal health care provider is very important. And so I think vetted sources. I think that's the only way to get good information. CDC, FDA.
You know, I think we're getting close to the end of this, so I do want to thank all of our panelists. First off the bat, of course, Sonia Neely Johnson, of course, and Maceo Payne, Payne, doctor, and of course, Marlo Irwin. Thank you, Marlo. And Dr. Michael Lenore, you're going to close it up with your statements. Thank you, Doctor.
I'm going to close it up with the statement. Well, I want to thank the panel, and I want to correct one faux pas that I made. I did not introduce our very excellent moderator, Mr. Martin Wyatt. Mr. Wyatt is a well-known broadcaster in our area, the winner of several broadcast awards, and I think you can see by the way he conducted this panel, a very experienced broadcaster and moderator. So I certainly want to thank him. I personally want to thank other members of the panel because you've given me some ideas about schools. Dr. Johnson and Dr. Payne always so coaching on these issues. I help create and help me create my own thinking around the process. And certainly, Marlo, thank you for giving us an insight into what it's really like on the ground for a student. I think I've done a lot of these panels, as I'm sure other people have, and I think this is one that is probably one of the more important, more insightful panels that I've been a part of, and I'd like to thank everybody from my perspective, and certainly the Black Women's Health Collective, and from our side, Ms. Mignon Irwin, who has also been, Mignon Lenore, I should say, who's also been a very, very instrumental in trying to help us put this together.
Well done. That's all I can say, and I thank the panelists. Thank you, Dr. Lenore, and of course, the Black Women's Imperative and African American Wellness Project for putting this whole thing together, and we look for more in the future. Thank you very much.
Thank you.